we're mama bears. We're not going to let anybody say anything to our child, to our husband.
Right.
But you're right. We don't advocate because it's almost like a guilt. I don't necessarily think that we don't feel that we don't deserve it, but we're just so used to being there for other people that it is very difficult to say, because we're used to having to be strong for everybody else.
Hi, I am Sierra Earl. You are listening to Lean In and Listen with Sierra. This is a boardroom for all women. This is a place, a space for women to be their authentic selves. So grab your cup of coffee or your cup of tea and lean in and listen with me. Good morning. I'm super excited that you guys are here today. Of course, I am the CEO and founder of the Boardroom and Lean In and Listen. Today, I have an extraordinary topic for you guys, and it's healthcare. I have a special friend here, and she's very special to me. Her name is Lynnie Harrison-Greene, and we're going to talk about all the abbreviations of that today. But she's a PA, a physician assistant in neurology. Now, a lot of people don't know what that is, and that's why she's here to express and explain what she is and what she does for a living. But I'm going to turn it over to Lynnie. She's going to give us a little background of who she is and how she's gotten here today. Lynnie, I know it. So let's just start off by, who is Lynnie?
Well, again, like she said, I'm Lynnie Harrison-Greene, and we'll get into that in a minute. I am a mother, a wife, an entrepreneur, and I'm a physician assistant. I'm a physician assistant, for those that don't know, or we also go by PAs. In this new world, we're also called physician associates. I am a licensed healthcare professional. I work in collaboration with a physician. I evaluate, diagnose, and treat patients. A lot of us work autonomously, so even though we collaborate with a physician, a lot of times we're not in an office with a physician. We have our own panel of patients. We see our own patients.
Okay.
A lot of times PAs work in surgery. We were created during the military, so about 50, 60 years ago, we were created to work as extenders of physicians in the military. And then as population grew, they saw a need for it in the general population, and so here we are.
And that's where we are now. Okay. Yeah. Okay. Now, you didn't start off in this industry. How did you get here?
This is a second career for me. So I used to work in, so when I came out of college, I worked in sales for a period of time in account management, and then I moved into project management, which was with my brain and how I think, it was a very good career for me. However, I worked from home, and one day I was like, I don't even want to get out of my bed and go into my office. I don't want to do this anymore. And so through a lot of prayer and soul searching, I thought about what is it that I want to do, and I started to research some other careers. And I actually thought I was going to go the nurse practitioner route. Because I knew I wanted to go into medicine at that point. This was probably around 2013. But to be an MD, that's a really long road. And this point, I was in my 30s, and I was like, I don't know if I want to be 45 coming out of medical school, once I meet the prerequisites in med school and all that stuff. So I started kind of researching, started working on the prerequisites. I didn't even know what a PA was at that point.
Wow.
And then by happenstance, I was in class with two other females that were working on their requirements for PA school. And so we got to talking, and they were just like me, second careers. And they were like, why would you go that route? Why not go the PA route? And so they got me in touch with someone that worked at UAB PA program. And so I spent some time meeting with her, shadowing, and it just really was a very good fit for me.
Good. Wow. I mean, sometimes I know that, like, even for me, I was pre-med undergraduate, and then I ended up following my father's footsteps after school, and I was like, I don't think I want to do this. And mine was psychiatry, and I was just like, after working up under a psychiatrist for a couple of years, doing treatment plans, I was like, no, I think I need to go back. And that's when I got into the financial industry, and it just took off. And I mean, I've been in it for almost 2 decades, and that happens, right? So it sort of tells people how old we are. We've been out here for a long time.
How well seasoned we are.
how seasoned we are. Yeah, we are very, very seasoned. So you've been in the healthcare, and I know people are dying to lean in and listen. How has healthcare changed over the years?
So I've been in healthcare 7 years, so I can only speak to really what's happened in the 7 years, which it has happened quite a bit.
Right.
The more that people are engaged in social media and technology is taking off, I think people are looking more for a holistic approach, naturopathic medicine, and so medicine typically is not, we're not trained in that way. You do have DOs, so doctors of osteopathic medicine, and they're trained in both. So, if you go to the doctor, you can have a DO or you could have an MD. MDs are typically trained under the general medicine model. And a lot of that, honestly, is more acute care, pharmacologic type of care, and which is how PAs are trained as well. We're trained under the medical model as well. But we're moving into a world where people are researching more, sometimes to their benefit, sometimes to their
I was going to say, is that bad or good? Like, a little bit of both.
A little bit of both. I mean, I love an informed patient. I love patients that are involved in their own care. I like to see, when I do treatment plans, I want them to be a part of the process because patients are more willing to buy in and actually follow through on treatment when they feel like they've been a part of it. And it's their own health, because when they leave my door, they're obviously responsible for what happens past the point of what I've educated them on.
Right.
So, yes, I do like when they educate themselves some. Unfortunately, what we have found in the general population is a lot of people don't know how to decipher good research from bad research.
Okay, and how do they do that? Or what's the best way to...
That's a good question. I mean, in the world of social media, everybody looks like they know what they're talking about.
Right.
Everybody
Which
looks
I
like...
hate it, to be honest with you. I hate it.
I do, because especially in the world of medicine, you have people that get sound bites from here and there, and now they think they're an expert, and they don't really spend a lot of time researching, right? And that's difficult to say, because real research, if you don't understand the research process, if you don't understand how to break down studies, it's very easy
to get caught up into whatever's new.
And most people can adjust and change statistics to meet whatever they wanted to say. Right. So it's a slippery slope, and it's very difficult. We always laugh in medicine, if you Google, you're going to end up with cancer, because that's literally what it always leads. Because it always leads back to that. People always come in, and it's just like apocalyptic of, oh my God, do I have cancer? And you're like, whoa.
Hold, pump the brakes.
Yeah, let's reel that in. Let's talk about this and what your symptoms are and where we are. Or a lot of people are sharing information. Well, my cousin this and my cousin that. And you're like, okay, well, so in medicine, we're having a fight against that wave. Right. And there is some mistrust. There's a lot of mistrust in healthcare, as, pharmacologics took, you got big pharma. A lot of that took center stage, and there's this perception that, physicians or healthcare providers treat based off of what they're getting paid versus the actual patient.
Yeah, the referrals and all of that.
Yeah.
So how true is that, Lynnie?
There was a lot of truth to that at one point. There were a lot of sales reps at one point whining and dining a lot of professionals. I don't want to say everybody took advantage of that, because they didn't. There's some amazing and phenomenal healthcare professionals out there. But that was a thing. Yeah. I mean, I would be lying if I said it wasn't a thing at one time. But laws change, legislation changed, so there was a lot of crackdown on that. If it's still going on, you really don't hear about it.
And to be honest, if you really want to be honest, it's in every industry.
100%.
So let's be honest about it. It's just not in healthcare. It's in every industry. People take advantage and use it for their own benefit.
Right. Yeah. Now, what I will say, because I don't want everybody to be like, oh, she's confirming what we know. That's not what I'm saying. That's not what we're saying. There was a time where some of that was happening in some offices. I recently seen a reel about how there was some talk about vaccines, and the reason why we push so many vaccines is because pediatricians are getting paid for it. That's completely false.
I know that's
false. 100% false.
Right.
The reality is pediatricians are some of the lowest paid providers in the industry. Primary care in general is one of the lowest paid in the industry. So you're truly doing it because you love it, not because you're there to make a lot of money. So I want to make sure that I preface that has not happened across the board, and you really, honestly, I've not seen it in my
Right.
career. I don't know anybody that's taking, backdoor, with the laws. I'm sure if they are, it's probably
Right.
real quiet.
Yeah.
But yeah.
Well, I don't know if I should go here, but I'm going to go there anyway. I know for me, being a mom of 4, especially with this last baby I had, oh my God, it was definitely an experience. But I find myself advocating more and more, not for myself, but for my kids. And I will say, as professional women, we have the tendency to know how to advocate for everybody but ourselves. Right? And so what happens is we get together, and that's why I like this platform to be so diverse, is because we need to understand each other's why. If you understand my why, then you can help me. And I don't have to go down this long, drawn-out bio of myself. But if you understand my culture, if you understand who I am as a woman or me as just a person, then you can better help me. So I had the tendency when I go into the doctor's offices on my children's behalf and even my husband's behalf, because he hates it, but I go to the doctor with him too because they don't ask questions.
They don't.
And I have the tendency to ask a lot of questions, right? But I want to make sure that I'm not aggressive. Let's be honest. I want to make sure that I respect the physician's point of view and their who they are. How do you do that and not come across like I know your job? Because my background is, I've had a lot of predoctoral courses and I like to research. And so a lot of things to me happens in threes, It needs to be a 3-year course when it comes to vaccines and all that kind of stuff. So I'm very particular about it. It's not like I'm going against the grain, but I'm asking because I am highly aware of what's going on. Right. So how do you do that and still be in a mom's place and not in a professional's place and be heard?
First, I welcome when a spouse comes in because the reality is with the patient population that I work with, they are very forgetful. There's a lot of in neurology, there's a lot of cognitive
and you need
impairment.
Support.
So yes, even in younger adults, or you just forget. Like even with my own healthcare, if I don't write it down,
I forget.
Yeah. And then afterward, I'm like, oh crap.
Right.
So, and I actually specifically work in neurology headache, and a lot of headache has to deal with lifestyle management. And a lot of people are not forthright about their lifestyle.
Right.
Whether they're drinking, smoking, exercising regularly, how often. Headaches are very subjective. We can't look at a lab necessarily if it's, unless it's secondary to something else. We can't look a lab or image to see or track how well you're doing. It's all very subjective. So a lot of times if you're not honest, it impedes our plan, right? And so I welcome when a spouse comes in because they're very honest, right? I think the turnoff for a lot of people is when, and it's not even just the spouse, it's the patient themselves of, I have a biology degree. I know. And you're like, I love you, but your biology degree does not trump my medical degree. You know what I mean?
By the way, I do not do that. I do not do that, Lynnie. My husband says all the time.
But it happens.
Yeah, I can believe it.
And I will tell you, that's when the turnoff happens, even with the patient themselves. So it's more like, okay, here we go. I try to stay open. I'm very good because of the population I work with. A lot of times they're coming from a situation where they weren't heard from providers from so long.
Yeah.
Or they were pushed to the side.
Right.
Or they're in a lot of chronic pain. So, and what do hurt people, or a lot of times they're just venting. And so I try to always remember that. And I try to always be an advocate for them and really listen. Unfortunately, just like any other profession, when you've worked in something for a long time, you get some providers that get very jaded. And so you're also having to work through that perception as well, right? But as far as your question, it's really, I think there's nothing wrong with being there, being engaged. I prefer a patient that's engaged and active and has a lot of questions than one that just sits there and pretends they know what you're talking about. And then you come back in 3 months and you haven't done anything that we talked about. Yeah. And it was mainly because you didn't understand. So I have a habit of saying, do you understand what our treatment is? And they'll say yes. They always say yes.
Right.
And so I'm like, okay, so tell me what it is that you heard that I said.
Right.
And that's how I learned if they're with me or not.
Right.
Because at the end of the day, it does not benefit me
if they
go
don't
home
understand and they don't
understand
implement
and they don't do it. So I try to incorporate that into my practice of, do you truly understand? So explain it back to me what you understand. And if they don't, I write it down for them.
Right.
Okay. And that's why I like the spouse to be there or a
now,
caregiver.
Now listen, I just have to just throw this out here. Now, when I go into the doctor's office
I know
with
you
my
got
children,
your notebook and you probably have your you're a lie. I know you do because you carry that book everywhere
I do. But when I really go in, I just sit there and I don't say anything. Now, listen, if I don't get what I need, then I start to inquire.
I love
this
you.
Is it.
And I find it so hard to believe that you don't say a word. I know you too well.
Oh my gosh. So,
and you're very expressive in your face.
I am very expressive in my face. It's true. It's so true. I'm just going to leave it at that. But you're right. But I just want to make sure that I am definitely heard. And I'm going to tell you, and I'm going to share this story with you guys. I'm more, like, I always advocate for everybody. And sometimes I don't say anything really for myself. And I'll give you a prime example. Baby number 4, Benjamin. Let me just tell you about Benjamin. And I've told this story a little bit, but I really never really went into details. I was very quiet with Benjamin when I was pregnant with him. He was baby number 4. And a lot of people may think I knew everything because I had 3 kids. But every pregnancy is different. You feel different. And so I wanted to be almost treated like an infant, like act like I don't know anything. And it seemed like everywhere I went, it was like I was supposed to know because you're pregnant with 4. Leave her alone. She's okay. But I was really fragile, to be honest with you. And I remember the day that I was supposed to give birth, which I did. I went in, I told my husband.
Spectacular fashion.
Oh, it's just a grand finale. And if it happened the first time, I don't think I would have the other children. But through the pregnancy, I prayed. I did not want to be touched. I did not want epidural. I just wanted to have a natural birth. Okay. And I don't know why I said that to myself, but that's really what happened.
Are you glad that it happened?
And I'm actually glad that it happened, but he is definitely the grand finale, and he's the bookend, and there's nothing else coming after that. But I remember telling my husband, I said, hey, I think it's time. I wasn't all dramatic, and I think when it comes to my healthcare, I'm not really dramatic, but I'm very, detailed. Listen, I'm contracting. It is back-to-back. It's not like piercing pain, but it's back-to-back. Just the way it was 10 years ago, pregnant with Jackson. He said, okay. I said, I want to go in. Well, actually, I told him that night. He said, well, honey, can we wait till the morning? Because he didn't hear it in my voice, like we needed to go. I said, we can wait till the morning until they open. I went in.
So it's Ed's fault.
It is his fault. It's his fault. That's what he said.
Okay.
And so I went in, and no, it's actually not his fault. I went in, and they sent me home. My physician was actually on vacation, and he told me, Sierra, do not have this baby until I get back. And I said, Doc, I can't, I can't control that, but I'll try my best because he delivered, my children. Where that group delivered my children. And so, long story short, this young lady sent me home. And I said, listen, it's baby number 4. I mean, I'm not in excruciating pain, but it's so back to back. Like, they're every couple of minutes. She checked me, and she was like, but you're not dilated all the way through. I said,
were you dilated at all?
Yes, I had dilated. I said, okay, because I had the tendency to push the button, right? And I was like, Sierra, don't do that. Listen to the physician and take your bottom home. Guys, I went home. And I laid down, and I said, okay, Lord, please, you let me know when it's time to go in, right? Guys, I went home maybe 3 or 4 hours later. My husband had court in maybe like an hour and a half away. And I said, why don't you go ahead and go to court? Just trying to be that good spouse, like, I got it. I'm strong. I can do it. The doctor told me to go home. All I can tell you is a couple of hours later, I was in the car holding on to every and anything I could put my hands on. Got to the hospital, could barely get out the car, got on the elevator doors open, and whoosh, my water broke. I just collapsed into the doctor's arms. It was like a flew of people. Guys, it was like a Lifetime movie. They threw me in the first bed and I had to push. He was here like in a couple of minutes. That was traumatic. That was a traumatic experience. And for that, I was like, we're done. This is it. I got my quad and this is a wrap. But everybody looked at me like, I'm so strong. You got this. But that moment, after having him, when I say I speak very quickly now, you don't have to like me. You don't have to care for me, but I'm going to say what I have to say, and I'm going to say it very, very nice, but I need you to hear what I'm saying to you, because I knew that morning I would give birth, but I fell in line and I went home. So, Lynnie, what would you say to that?
You know, so I'm going to kind of transition to a mom hat, right?
Right.
We're mama bears.
I know, and we know our bodies.
We're not going to let anybody say anything to our child, to our husband.
Right.
But you're right. We don't advocate because it's almost like a guilt.
It's such a guilt.
It's a guilt of, I don't necessarily think that we don't feel that we don't deserve it, but we're just so used to being there for other people that it is very difficult to say, because we're used to having to be strong for everybody else.
Right.
So I think that that's just a change in attitude that we as women need to figure out therapy, whatever we got to do.
We need a whole bunch of therapy.
I mean, but it's the reality. Like there's that, what's it called? That mental load that we take on, right?
Yeah.
And constantly carrying, like now, I'm sure just like me, you are thinking, okay, I got to make sure dinner's at a certain time and I got to get to this or that. And we're always thinking that we're always on, to the point that our needs are very last. And when it comes time to speak our needs, we don't know how to do that.
Yep, you're right.
Because it might inflict with what somebody else thinks.
Right.
And I don't honestly have a solution for that outside of, as women, we have to center ourselves and start putting ourselves first, creating boundaries in our own lives, so that way we can be there for ourselves first and be able to speak up and advocate for ourselves, because it does leak out in those situations where you go in front of a professional and they're like, no, you're good, and you lean on that when everything in your body and your mind is screaming,
telling you, like, put me in a room and just monitor me for a minute.
Leave me here. Yeah. And like from a healthcare professional sense, I don't work in women's health. I don't work in that area, but I'm pretty sure I don't know that I would have sent you home if you were already dilated and this is your fourth, because we know as you have more children, it happens much more rapidly than it does with the first one. And so I'm not sure I would have sent you home. I'm not sure why it happened that way. I don't know. Maybe they didn't have a room ready. I don't know.
Ooh.
And that's a whole nother
topic,
there's a lot behind closed doors that happens in a healthcare setting that people don't understand or appreciate until you work in that setting.
Right.
So honestly, I don't know, and it's very unfortunate. Yeah. I'm glad you and Benjamin.
I'm glad we are okay. Yeah.
But there are stories where people are not okay.
Yeah. And this could have really turned into a very devastating ending. But I thank God that that I was cognitive enough to say, okay, Sierra, now you need to talk for yourself. Like, get up and get out. And I barely could get up and get out.
And like you said, that it's made you in other situations now just be...
Yeah. And then, but you do have a lot of women that may be over the top and always crying wolf. And you're like, you know what? Go home.
Kind of what
and then it can affect us
Mm-hmm.
that I'm low key and I'm not saying anything. But when I am saying something, I'm not heard. Mm-hmm. And so I have the tendency to speak up and speak out a little bit more than I used to before even children too. Mm-hmm. Right. So. Oh yeah, that was a story, guys, and I know from the physicians or the medical standpoint that you just never know. right? Because you can have some people that come in and then you're in the bed for days.
Yeah.
And it was just unfortunate, but I thank God that I'm okay, you know? So, yeah, yeah, that was pretty touchy. So tell me about the culture incompetency going on in today's society now.
So I think we spoke about this offline some. So I think in medicine, there's obviously so much that you have to learn when you're studying medicine, right? And so a big part of it is your anatomy, physiology, pharmacology. You're getting all of your basic general medicine. Now, I will say when I was in PA school, we did have a cultural competency course. It was the first time that they had ever had one. Some of the medical schools are starting to incorporate that into their curriculums now, but it's not, I don't think it's pretty widespread at this point. I think, you just see it here and there, and it's extremely important. We live, and it's something that should have been addressed a long time ago. We have a very diverse population.
Yep.
Racially, ethnically, religious, and it's very important to understand who you're treating, what the background is, what the cultural norms are, what the religious aspects are. For instance, if you have a woman that wears a hijab that's Muslim, they're going to really need a female provider, because especially if they're married, you can't touch a woman that wears a hijab, or she cannot take off her hijab so you can examine her as a man.
Wow.
So you have to be cognizant of those type of things.
Right.
So I think it's very important that in our curriculum and in our continued training, because we do continued medical education, that really needs to be incorporated. I will say, outside of the cultural competency course that I have never taken or had to have taken any additional continuing medical education around cultural competency.
Right.
And I really do think it's important. I mean, we live just in an extremely diverse area. Or just the world. And so to be good global stewards, especially in healthcare, you have to be able to understand who you're treating. And sometimes if you don't understand that, it can almost look as if a patient's being difficult, when in reality, they're not.
Right.
And then there's just some diagnoses or comorbidities that are expressed more in certain populations. And so you have to understand that when treating, because you could be totally missing a diagnosis if you don't really understand, who you're treating.
And their background. So how do you tell someone how to pick a physician for them personally, for their family? How do you choose? You can't, it's difficult. You may see somebody with a great degree, they went to the greatest school, they've performed, or they've had the best internships and all of that, but how do you really know that you have the best physician?
It's difficult, because, you could, and that's hard to say until you get in front of a person, right? So you could look up, online and see, like you said, their degrees and things, but that doesn't necessarily mean the bedside manner is great.
Right.
That's just the reality. Just because you were able to score the highest scores that you can and you went to the best, best programs out there, doesn't mean you're necessarily the best provider.
Right.
For me personally, when I go to the doctor to take my son, I'm looking for someone that has good bedside manner.
Right.
That to me is very important. That you're hearing me, that you're listening, that you're actually looking at our situation and trying to understand our background and, meet us where we are, versus just speaking a bunch of medical jargon at me, diagnosing me and getting me out.
And you don't understand me.
So I do like somebody that takes a little bit extra care. Some people don't care about that. Some people are like, I don't care if you have that bedside manner. If you're smart, if you're treating, and it works, and that's all I care
But
about.
it also depends on what your need is. Like, for an example, I have 4 children. Number one, my first one, I used to travel a lot in the banking industry, and I was down. Oh my God, I was coming out of a meeting. I was not here in Birmingham. I was traveling so much, and I start contracting very early. And I had number one early. Okay. Number 2 and number 3 sat up like little queens and their girls, and they didn't want to come out. Right. And then they finally turned on their own. And number 4, he just made his debut just the way he wanted to. But all of them, I had all of them vaginally, but all of them were different. Now, number 1, I've been with the same doctors for a very long time, the group, and they've been great to me. But in that group, The doctor that probably didn't have the best bedside manners is the one that told me he is coming.
Mm-hmm.
Now, a lot of people probably didn't like him, but he's the one that prepared me that he was coming. So it depends on the need, because at that time, I didn't need the best bedside manners. I needed you to tell me to equip myself because my child may be here a little bit early, right? And they still didn't know to this day what happened. But I pushed his behind out, and he's here, and he's great. Right. But you have to, it depends on what your need is. So I guess for me, the best bedside manners is not always the greatest.
No, agreed.
Like for me, I don't want you just talking to me. I need you to do your job.
Right. Which
I want the research people, right?
When I say good bedside manner, you can do both.
Right.
I think what helps me is I have a sales background. So I'm very good at reading people.
Got it.
And fostering a relationship very quickly. So while I'm laughing and joking and asking you questions,
I need you
pertinent.
Right.
So I'm able to decipher who you are, and I'm able to get you comfortable. Because a lot of people don't divulge a lot of information because of distrust very quickly. But if I can make you comfortable quickly, that makes you want to talk. And that makes you receptive too.
Right.
And I'm grateful. Like I hate that I didn't start off in medicine. For financial reasons, because I was pretty broke when I was working in sales. Who
you telling? I think I would. To be honest, I would have been a physician.
Yeah,
I really would have. But hey, that's on the topic.
But I am very grateful. You know, things always happen in the way that they're supposed to happen, and so I'm very grateful that I do have a sales background, because I think that has lended a very good intangible skill that most people don't have in the clinical setting. So it's really allowed me to build relationships with resources around me, because I work in a hospital, so I'm able to pull resources from other services. And then also with my patients, to be able to talk to them and connect with patients very quickly and very easily. It's very natural for me to do it versus, you know, I watch when we train our residents, they're very focused, or our PA students are very focused on getting the history, getting the diagnosis, and not really
versus
understanding.
having a conversation.
Yes, and understanding the art of conversation, because it is an art. It is an art of, you know, being able to get a lot of information very quickly. You know, and we are trained to read body language and to utilize that as part of our evaluation. But again, the art of conversation.
It's an art. Yeah. It's definitely an art.
It's not taught. In medicine, so
that's where the psychology piece comes in. A lot of people actually need that because it's an art, and I didn't know, but my husband always says, I don't know what it is. Just people just clinch to you, like all the kids. It's like I'm just big mama bear, but I have a natural art. I just love on
which
everybody.
Some people have it innately, and then some of it probably has to do a lot with your background in psychiatry. Yeah. So it's, you know, it's something that you definitely learn, and then you also have innately. My husband, Lord knows, he's got charm and conversation in space.
Let's talk about that.
Oh, God.
So you feel like your husband is more charming, and you feel like you're more like laid back?
You know us, 100%. 100%. I mean, we're talking here because we're speaking amongst friends, but you know, in our setting amongst our friend group, it took a long time for me to open up, have a lot of conversation. I'm very much a laid back. I watch, take it in, learn some things. My husband, he's not going to know a stranger. He's going to start talking. Everybody knows him. Everybody's going to you know, talk to him. He's going to talk to everybody. Yeah. We're just very polar opposite.
Yeah. So, you know, tell the viewers, because listen, Lynnie just doesn't just work. And she has a beautiful young boy, and she's married. Like, how do you do all of that? And then y'all also have like a business that y'all are about to start too.
A lot of caffeine.
A lot of caffeine. And we actually have it like now, like grab your cup of coffee and your cup of tea, because you're going to need it. But like, how are you able to balance it all?
Honestly, I don't know.
Are you balancing it? You struggling?
I don't know that I am, and I'm okay with saying that. Yes. You know, it's nothing that I set out to do. It wasn't. I've never wanted to be an entrepreneur. That is definitely my husband, and so I've been dragged along, kicking and screaming, and then you get into a point where you
got to get in.
You got to take the bull by its reins and be like, okay, this is what we're doing.
Yep.
So I've always been career focused. That part was easy. I've always, whatever I wanted to do in my professional life, been like,
Let's
this
do
is
it.
what I'm doing.
Check mark.
Yeah.
Mm-hmm.
As you know, I never wanted children. That was never on the agenda.
Say that again.
I never wanted children.
She never wanted
I
children.
never wanted children. That was not
and
on my
something
life's
about
agenda.
being connected with me, you're going to have children.
But
I believe in multiplying. You know?
I'm going to blame my husband for that one. But
that was a good blame, though.
It is a good blame.
Yeah,
he
it
is
is.
the best blessing. My son is the best blessing that I never knew that I wanted.
Yeah.
So I'm glad I had him, but it's hard.
It's hard.
Yeah, so, just that piece came, and that happened. So then I had to adjust. And I will be honest, let's talk about that for a second. Being in medicine and having a child, it was very difficult for me. And I had him in COVID. So you got to understand we were in the middle of the pandemic.
And how old were you when you had?
So I was 40. I was about to
40
turn
and
41.
pregnant.
In the middle of a pandemic, we don't have any family here. So I didn't have a support system outside of my friend group. But again, we were limiting how much time we were around each other. Right. So you're in a very isolated situation. And what a lot of people don't talk about when they have a child is the depression and the anxiety that comes with it. And then when you're working in healthcare, I think sometimes, like you said, we don't advocate for ourselves. We don't think about ourselves. So it really didn't dawn on me that I was severely depressed at the time. I was very depressed, and I never talked about it for a long time. And I was in therapy, and it got to the point that he and I were doing therapy together because we do a lot of preventative therapy, like maintenance. And we went, and I showed up one day, and she was like, "Ooh, child, you need to get on some medicine. It's time." And I just started boo-hooing. And I'm like, "You're right, I do."
So time out. And people don't understand, like, even in your friend groups, and I said this before on another podcast, like, a lot of people that I know as women, we don't talk about a lot of stuff. When we get together, we just want to be friends and just enjoy and not talk about the kids, the husbands, the career. Like, sometimes we don't even know what all of each other do, but we know that we're connected in so many ways. I say that because I knew in my heart you were.
I was severely
and
depressed.
I was like, you know what? I can't say anything, but then again, being Sierra,
somebody needed to say it.
But being Sierra, that's that mama bear in me. It was like, sit back, observe, and be there. Because cognitively, you have to be in a space to take it in. Yeah. But then again, friends, we got to be better for each other too, to know that we can say something, right? And so we got to do better.
Yeah.
Well,
so it was that situation of not wanting to admit, I think, that I was depressed, not wanting to ask for the help. Yeah. Then also having a transition in life of he's having to figure it out as a dad. Because neither one of us had our dads, growing up. So he's got that anxiety and pressure of like, what do I do? How do I do it?
And that's real pressure.
Yeah. And then I'm living in my world of like, I don't really have anyone to talk to about this. And I never cry. I'm a very headstrong person. Like, I'm very independent. And in that moment, it was probably the most vulnerable moment of my life. And I really didn't know how to express it or talk about it. And then you're in the pandemic, so you're not able to get around people that can love on you.
I'm about to cry. Like, why are we having this conversation right here on the podcast? But it's real.
It's very real.
It's so real.
When people talk about having a child, they never talk about that aspect.
They don't.
No one ever says, girl, you're going to be on the floor crying one of these days, or you're going to lose your mind, or you're not going to like your baby at one point. Right. Nobody says those things because they're kind of taboo to say.
They don't. I know. And they're like, you're unfit mom if you feel that way. Yeah. And you're like, I got all these thoughts. I'm feeling like this. Who can I talk to?
But when you join the Moms Club and you get past it and you start talking about it, everybody's like, oh, yeah, I went through that too.
Yeah, I went through that too. Yeah.
And you're like, well, why didn't you tell me that this was going to happen?
Well, I come off like Miss Know-It-All, so I have the tendency not to say nothing. And I'm like, if people want me, if they need something, they'll come to me. But then now, after having number 4, I'm like, I don't care what you think. I'm going to tell you. Now, you may not appreciate me right now, but you will appreciate me later. Yeah. 4 children, 4 different experiences. I'm not I don't have a PhD in it, but I know enough.
You technically do have a PhD in it.
I know enough that my weight went up and down. My body went up and down. My mind went up and down. What I used to like, I don't like now.
Exactly.
And my husband's barely hanging in there because sometimes I don't like him.
That's hard.
But,
to get back to your original question,
Yeah.
so like, I had a child. My husband decided to start his first business in the midst of all of that.
That's another baby.
Happy. And he did this without even
Consulting
talking to
to
me
you.
about what was happening. So I'm over here breastfeeding and labeling
Pumping and
clothes.
stuff.
And trying to label clothes. And, at that point, I'm breastfeeding. So
Yeah.
I'm having to feed him every hour and a half. I'm not sleeping. He
Right.
wouldn't take a bottle. So my husband couldn't even do any of the feedings. So I'm exhausted. I'm depressed. And I'm over here tagging clothes because my husband started an online retail business at that time.
Right. I remember. We
So
got some of
it's
those
like-
clothes.
Yeah. So it's like, oh my goodness, what are we
Right.
doing? And so that's kind of, I think we've just constantly transitioned. And then we bought another house. We built a house in the midst of that. Then my husband decided, I think I want to open a bar. And so then that morphed into, it's just this,
Ongoing.
Do y'all see the pattern here with my husband? So
Yeah.
it's just, but part of being a wife is supporting dreams.
Right.
And fostering and doing whatever we can to help.
Right.
You know that.
Right.
better
And
than
y'all
most.
always ask me, Sierra, how you doing all of that?
It's a
like,
lot.
what you
And
doing?
you have to be extremely organized.
Right. You do.
I make fun of you and your notebook, but
I know it,
you
but it
have to.
works.
I have one too. I just don't carry it
I
everywhere, but I
know.
have one. I don't know what I would
know.
do without my schedule and my phone.
Right.
And that's honestly how I do it.
Yeah.
And at my job, I'm not just a clinical provider. I'm also like our deputy director for our headache center. So I do a lot of our grant management. I run, I oversee the schedules in our clinic. If there's, issues with not just clinic, but the patients, I'm overseeing that portion of it too. So there's a lot that goes on there.
Okay.
So it's a lot to balance,
Yeah.
and it just takes a whole lot of.
So can you
sacrifice.
say you can handle it all in moderation?
That's the key, is handling it in moderation, because you have to bite off what you can when you can, and
Right.
sometimes you try to do all of it at the same time, and that's when you get overwhelmed, and you have to be
Right.
able to step back and say, okay, I'm going to take this moment for myself.
Right.
I do think that for me, I have to get better about making time for myself. I'm still in flux there.
I know,
working
but
on
you
that.
gave me a good pointer. You were like, Sierra, I go once a month and just get away. And I was like,
I do.
I need to incorporate
here's
that.
This. Any mom out there, do
Listen
a staycation.
to what she's saying.
Do a staycation once a month. Lock yourself in a hotel room and do whatever it is that you like to do. I love to read. I sit and read. I get food, and I do nothing. I don't have anybody asking me for anything. I don't work on anything else. I refuse, and it's the best thing for your mental health.
Wow.
And when I started telling people I was doing this, they were like,
I know she told me this, like a staycation. Like, what is a staycation? Like, you telling me to leave my home, go to a hotel,
Absolutely.
lock myself into the hotel, do
Absolutely.
whatever you want, and
Absolutely.
no kids, no husband? I was like,
but there's guilt that comes with it.
oh,
It's difficult to do because you feel guilty doing it.
Yeah.
But I promise you, after a while, you don't feel
you
guilty.
don't feel guilty. See, all of us have our own things to make us feel good. So I get that. Now, you are Lynnie Harrison-Greene. How did
I
that
thought we
come
were not
about?
gonna do
I'm
this.
telling it. Because a lot of people, okay, so Lynnie kept her maiden name, okay?
Mm-hmm.
And I wanted to talk about this because you have so many women that are in the legal industry or in the medical industry, and they like to keep their last names.
Mm-hmm.
All the execs and the professional women like to keep their last name. Lynnie, how did that happen? Come on.
So,
Just be honest with the
it didn't
people.
happen without a fight, I'll tell you that much. But so the reason I think a lot of people do it is because professionally you make a name for yourself.
Yep.
And it's very difficult to relinquish that,
Mm-hmm.
especially when you've made a great name for yourself in
Right.
that space.
Right.
And now people are having to relearn a new name.
Right.
The other part of that in medicine, it's not just a simple change. You have to go back and get your degree changed to that name because it has
All
the
of the
license has
documentation and stuff.
Yeah,
Yep.
all of that has to match.
Right.
And then, at your job, depending on what systems you use, it has to be changed there. And then
Mhm.
Social Security and all
Mhm.
these things. And it's like, it's easy to say that you should change your name for, and take your husband's, but it's a lot of work.
It is.
And some people would be like, so what? You know what you're getting to when you get married, but it's, to me, very just a personal thing.
Right.
And it just depends why you do it. For me, also, I had mentioned earlier, I didn't have my dad. My dad died when he was 9 or 10. I'm the only person outside of my oldest brother, who's my half brother, technically. We don't have the same dad. That literally still has the name Harrison. And so that meant a lot to me not to change it because my dad's no longer here and I was a daddy's girl. The only other person that also has a name is another girl. My uncle had a daughter, and she's in the same boat as me. Neither one of us, and ironically, she's a PA now, and neither one of us want to change our last name.
Now, if I became a doctor before I got married, I probably wouldn't change mine. Sorry, honey. And I really dealt with changing my last name when I got married because I was a proud Shara. I'm just going to be honest. And I was a daddy's girl. But since I had a very alpha brother, I knew he would carry on the name. And he jokes with me sometimes, like, you're not even a Shara anymore. I'm like, I'm always going to be a Shara. And I'm like, my husband benefits so much off my last name because I brought a lot of good stuff, you know. But I was proud of my last name. But I was like, you know what? Let me be a good wife and let me take on the Earl, which people pronounce it early. And so I always say, I share Earl, Shara Earl. But deep down, I'll always be a Shara. So,
and it's honestly just preference.
Yeah.
I don't think there's a right or wrong.
And I know your husband's like, green, green, green.
You know, in the beginning, he goes back and forth.
Yeah.
Some days he's like, I get it. It's not a big thing anymore. And then other days he's like, I still just don't understand, but it is what it is at this point.
But the baby boy, he's a green.
He is.
Yeah.
Yeah. His last name is Green, and he knows it, and that's fine.
Yeah. Well, we are wrapping up, and I appreciate you coming today.
Thanks for having me.
Let me just tell you, healthcare is so important, and I'm here to let you know I want to be a resource for you. I want to be an advocate for you, and you need to be an advocate for yourself. But just having Lynnie on here today to just tell us a little bit about healthcare and how to be advocates for ourselves is so important. So, Lynnie, thank you so much for being with us today. Tell the viewers, tell the people out there, like, you all are starting a new business. What is this new business? And help them, know where you all are. I mean, because, we're moms, we're wives, we're trying to keep our relationships together. And sometimes we need to have date night, and I believe in date night. So, Lynnie, tell the people where to find you.
So, we're in Hoover. Coming soon, Six and Stone, Hoover is coming across from the Hoover Met in the Knox Square community. We'll be open, hopefully, in the next few months. We're in construction period right now.
Yeah.
It'll be the first of its kind in Hoover. It's a cocktail bar. We'll have some small plates, 21 and over. Please join us.
So we're trying to find a balance here, right? We're moms, we're wives, we're execs, everybody works, but you got to make sure that you connect with your spouses. So they have created something that will definitely take care of that need. So if you're looking for that, you'll also see it on my website as well. And I'll make sure I have some resources there for you all to contact Lynnie. Thanks so much. Appreciate it.